Dyeing a dying eye. The authors of this video presentation have no financial interest to disclose. Corneal tattooing techniques are several. The common ones include surface tattooing and intrastromal. Surface tattooing can be done using anterior stromal puncture or chemical reduction. Intrastromal tattooing can be done using a manual technique or femtosecond laser. For surface tattooing, different reagents can be used like platinum chloride and gold chloride that form a chemical reaction with hydrazine hydrate to give a uniform coloration to the cornea. In intrastromal tattooing, a lamellar pocket is made in the corneal stroma and reagents like an ink or soot can be used to stain the stromal pocket. A 23-year-old male presented to us with no perception of light in his left eye. This was a non-seeing eye which was microcornea with a chorioretinal coloboma and a retinal detachment. The cornea was clear, good adequate thickness was there. He had a dense white cataract and an inferior iris defect. Corneal tattooing was planned using a dual approach for a longer retention of the dye. The corneal epithelium was debrided using a 15-number blade. A 5 mm curved partial thickness incision was made superiotemporally at the limbus using a 300 microns guarded knife. Stromal dissection was started from the lamellar incision. Dissection of the pocket was completed using a blunt lamellar dissector. Indian ink dye was then injected into the pocket and spread diffusely. The tunnel entry was sutured using 10-0 nylon sutures. Hydrazine hydrate was then spread over the stromal surface. Platinum chloride crystals was applied over it, which caused a chemical reaction to give a black uniform coloration to the stromal surface. Bandage contact lens was then placed. Post-operatively, the patient achieved a uniform and dense uptake of dye all over the cornea, including the surface as well as the lamellar pocket was stained uniformly. He achieved a good cosmesis with now both eyes looking equally dark. To conclude, dyeing a non-seeing discolored eye is several times important. It is a vital cosmetic requirement to avoid social stigma in patients who cannot perceive light. A longer retention and deep pigmentation is important to prevent repeating the procedure. In such situations, dual staining, that is of the surface as well as the stroma, is recommended when the corneal thickness is adequate. Thank you.